Hi, Dr. Eric Smith here with Smith Chiropractic in El Cerrito, California. Wanted to go over some of the most common questions that I hear in the office pretty much every day. Well, kind of starting with the head going down, we treat headaches, we treat neck pain, we treat TMJ problems, we treat pain going down into the arms, into the hands, carpal tunnel, we treat mid-back pain, a lot of digestive problems coming with mid-back pain also, as well as low back pain, as well as sciatica. Those are pretty much the most common reasons a person sees a chiropractor. Again, if you have some of the common conditions that chiropractors treat, neck pain, TMJ, shoulder and arm pain, digestive, mid-back pain, elimination issues, low back pain, sciatica, if you're experiencing any of those things, chiropractic might be right for you, and the best way to find that out is to have a consultation and exam with a chiropractor. This way, chiropractors have been helping people avoid dangerous drugs, surgeries, and injections for over 150 years at this point in time. So it's really in your best interest to look at alternatives to those more drastic healthcare methods. I love this question. Chiropractic means chiro, hand, practic, to do. So chiropractic is done by hand. We're literally putting our hands on our patients, correcting their spines through adjustments and manipulations. So the key thing to look for in a chiropractor is someone that you are comfortable with. You need to be comfortable with them, with their personality, with their office, everything ranging from their hygiene to the language they use in talking to you. It's essential that you feel respected, that you feel seen, that you feel heard, and you feel validated. Oftentimes our patients come to us and they've had medical opinions that were 30 and 40 seconds and been given life-changing medications. And they're really frustrated because they don't even understand what's wrong with them. At our office, we really endeavor to educate people as to what the problem is, how chiropractic can help, and then so that they understand the choices they're making. For over 150 years, chiropractors have had a mantra. And that mantra is chiropractic first, drugs second, surgery last. I think that mantra holds true now as well as it did in 1895. The key thing to understand is that medications and many drug procedures are pretty much irreversible procedures. Once you've had them, you've had them. And there's a risk associated with those procedures. In chiropractic care, there's very, very little risk of being hurt or even having any kind of complications to care. It's simply a matter of finding the right chiropractor for you, someone you feel comfortable with, who can provide you an accurate treatment plan, goal-oriented treatment plan, and deliver on the goods. In my office, we typically use X-ray as a clinical validating tool. In cervical complaints, for example, we do what's called a motion study. We want to see a pre-X-ray, identifying the area that we're treating, and we want to complete a treatment plan and show you a post-X-ray, demonstrating not only do you feel better, but we've documented your recovery. Absolutely, just ask my kids. They've all been adjusted since they were in diapers. Just kidding aside, well, no, I'm not kidding at all. Chiropractic is very safe for children. In fact, a lot of chiropractic problems that we have in our 30s, 40s, 50s, and 60s actually have their origins in childhood injuries and adolescent injuries. Kids don't express symptoms the same way as adults do. What might give you neck pain and a headache is going to give a young child an upset stomach or respiratory conditions because those organs and nerves are more sensitive, they're more actively growing at the time. So I strongly recommend that young children get checked by a chiropractor, and typically they don't need much work at all. They just need a little checkup and a few small adjustments to keep them growing up straight, avoiding things like poor posture and scoliosis. Those are all part of the chiropractic lexicon. Typically they don't. And I say typically because oftentimes we're working on what we think of as a hot joint. For example, someone's got a disc herniation, a disc bulge, they have some big issue with their spine that is causing direct pressure on a nerve root. Those conditions are very, very, very painful. And so when you're working on an area that is painful, it can be a little disconcerting. Also, people that have been in accidents, we're working with sprains and strains, things that have the tissues are inflamed, they're swollen, they're sore, so simply being touched or having them moved is painful. That pain is usually 10, 20 times worse than any discomfort that might exist from a chiropractic adjustment. The other thing to understand is that chiropractic has come a long way in the last 150 years. Now we have tools and instruments to adjust. We have machine-aided adjustments that are very, very gentle on the body. So there really is no discomfort with the chiropractic treatment. And you're looking for a chiropractor who has a variety of techniques under their belt, so that if you have any concerns about having something adjusted, that it might be painful, or you want it done in a very gentle way, the chiropractor can accommodate you. Absolutely not. And the reason why I say absolutely not is that medical doctors and chiropractors have the same legal and social status as primary healthcare providers, meaning that a patient can come directly from the street into our office. I'm responsible to make a diagnosis, administer appropriate treatment, and do so in an ethical and clinically validated way. So we have the same social responsibilities. We have separate licensure, separate education, and separate clinical requirements. So the professions are very different, but you do not need permission from anyone to see a chiropractor.